Right. Up, it is 10:15 and we are live. I'm really excited about this, Allison, because the more I think about it, the more we talk about it, the more I discover how many lessons there are in the healthcare conversation for conversations in general. And that might not sound intuitive, but if anyone stays tuned, they'll figure that out. I also hope that people who are here and hearing this conversation and have questions about their own healthcare, about their healthcare for their businesses, will put those questions in the chat. And if you're here live, let us know that you have a question. Put it in the chat. We will address it. If you're here in the replay, write replay, put your question, and Allison will be revisiting these to answer those questions. If there's something for me that I can help, I will, or I'll put you in touch. We want to help make healthcare easier for people. It's a big burden for businesses, and we all need it. It's huge. This is a huge thing. So it's a niche, but it's also like universal at the same time. Right. So I'm going to start, Allison, with the question I usually start with for everybody is, what's a difficult conversation you had to have that got you where you are today?
So first, thank you for having me. I always enjoy our conversations. So I think the difficult conversations are about how much healthcare actually costs.
So I'm going to pause there because we'll come to healthcare. I'm going to ask you something about you first.
Okay.
So what's a difficult conversation you had to have that got you where you are? So was it about healthcare conversation that was like the epiphany that got you here? That was a difficult conversation. But what's a difficult conversation you had to have?
So I had to have that difficult conversation with myself. I had a rather successful practice in another area of the insurance industry, more on the carrier side. And I was looking at my really lovely, for the most part, clients. I've been incredibly fortunate to have really lovely clients all my career.
And I don't think it's an accident.
And going, why are you having that problem? I could fix that 20 years ago. I could fix that. Why are you having this problem? No, this shouldn't be this way. And really had to have a conversation about, was I going to continue on the path that I was on, or was I going to change to a new path? And if I was going to change to a new path, I basically was going to cannibalize my existing business, which I did. And how was I going to live? And because that was blowing up my business. And it's been a wild ride. It's been a great ride, but it's been a wild ride. I have learned things I never thought I would learn. And it was worth it. But it was a conversation. It was a conversation with my partner. It was a conversation with my family. It was, a conversation with my clients, because I couldn't take any of my clients with me. So it was a number of difficult conversations.
You couldn't take any of your clients with you. Were you working with somebody else or for somebody else?
Yes.
You basically blew up your job.
I did.
With somebody else by saying, I think I can do this better and differently on my own.
Yes, I did.
Oh, and did you face those, who do I think I am to think I can really do this kinds of?
Of course I did. I still think that.
Well, I'm glad to know. Thank you. Welcome to the human world. And
yes.
It's important for us to put that out there. So it's really great to hear you talk about that honestly, because I think a lot of the business owners and the CEOs and financial officers who are making the decisions around healthcare are often in some of the same situations of that doubt that creeps in when we're doing something bigger, newer, going out on our own, blowing ourselves up, blowing up the business, cannibalizing it.
But that's basically what happened, right? I left all of that to do something new, and it was a really big change.
So change seems to be a theme that links the conversation in healthcare to leadership in some ways, or conversations and what's difficult in difficult conversations sometimes. So before we go right into the healthcare, because I'm not going to hold back on making you talk about all the juicy healthcare stuff. But before we do, what lessons learned from the way conversations happen in healthcare? What are some of the lessons that we might have for conversations in general?
It is very important to respect where somebody is in the conversation, and very important to respect how they got to that point. You know, depending on when I encounter people, they're either like, okay, I need to do this thing and I don't know what to do, or I did this thing and it's a disaster. You know, the people that the 98% of people that are just fine, you know, I never hear from them, right?
Mm-hmm.
So it's only the people that are a little bit more proactive, know they have a big thing, know that some things have changed and they don't really understand what to do. So if that's me or that's somebody on my team, or the people that have maybe not done what they were supposed to do, not really for any malicious reason, just, you know, healthcare is big, bad, scary. You do what people tell you to do, even if it's not the right thing. And, you know, there are consequences to that sometimes. So
Wow.
they're already angry when they get to me. So I think it's important to respect the anger and then just try to help them solve the problem.
There's so much wisdom there, because that is what happens everywhere. We bring so much judgment to
Correct.
people for being in this situation they are. Well, you got yourself into this, or you should have known. Well, you made the decision. How often do we hear that about things? But when you accept people where they are and however they got there, and you create that judgment-free zone, there's a lot more opportunity for creation and creating new solutions, which is what you do, right?
Correct.
You're creating completely out of the box solutions from what people already think they know.
Yes.
And you can't get there if you're bringing all those judgments in with you. And you have to get them to release those judgments too.
Yes. So
that probably takes some good leadership moves.
It does. I had a prospect, not a client, who I said, okay, I said, why are you talking to me? What is it that you really want? She said, well, what I really want is Cigna at 50% of the cost. I said, well, I can do a lot, but I can't do that. And it was not the right client for me. And that's okay. There's
Right.
plenty of people in the world and plenty of people that need an advisor. So, but you have to accept that, right? And accept that may not be the client for you, or maybe you do something with them you don't normally do because they don't want to do what you do, but they do like you and they do want to work with you or team. So I think that's important also.
Sounds like some really good leadership moves there. So now taking that great leadership gravitas, we've now established that you know what it is to lead one of these businesses. You know what it is to create a container for good conversation and a container for change. You know how to guide people towards what they want and also to let go when you're not the right person. How does that, what are the things people who are doing that in their own businesses need to know now about healthcare and the changes or the conversation?
So the change starts with whoever is responsible for the P&L at a business. You know, healthcare costs are increasing at a pretty big clip, and we have a convergence of things happening, right? So healthcare costs are increasing, but nobody wants to talk about saving money in healthcare, right? Because people think that if you save money in healthcare, you're going to get, excuse me, crappy care.
Yeah, there's an assumption there.
And the dirtiest,
think about it.
The dirtiest secret in healthcare is that the highest quality care is almost always an exception to the rule, but almost always the bottom quartile of cost. The other thing that people don't realize is that a knee replacement is not a knee replacement, and a complete metabolic panel is not a complete metabolic panel. I mean, the function is the same, but the costs can vary by thousands of percents and thousands of dollars. I mean, a knee replacement can cost $22. It can cost $36,000. It can cost $49,000. It can cost $82,000.
Why so much range?
Because
why isn't it like I go to the store and buy a Pepsi and Pepsi's always are the same?
Because every provider sets their own price. Every facility sets their own price. And people that do something often and well want to do something often and well. They know how to do it. They know how to price it. They know how many to schedule in a day, and they know how to do it right, what to look out for. And they don't want to see you again. Right? Whereas, so you want the guy that does 400 knee replacements a year. You don't maybe want the guy that does 1,000. You definitely don't want the guy that does 25. The guy that does 300 or 400 has a system. He has a team that he knows. He's in a facility that he knows. He's using products that he knows. He knows how long it takes to do. He knows what the pitfalls are, and he doesn't want to see you again because he wants to do the next one.
Wow. Okay, these are such different ways of thinking about things. The first is to recognize that the healthcare there's no standardized pricing.
There is no standardized pricing, and PPO discounts are really not all that good. That's the other thing.
Healthcare businesses are businesses, and they're just trying to make money from it. And they're not thinking about how to get you the best healthcare for the least amount of money. They're just trying to make a business work with whatever their particular model is. And that can really vary so much.
So healthcare is a little more complex than most businesses in that, there's a doctor, right? The doctor may be a solo practitioner or a small practice, or might be owned by a PE firm, or their practice might be owned by a hospital system. There are hospital systems. There are freestanding surgical centers. There are freestanding imaging centers. There are imaging centers and freestanding surgical centers owned by hospital systems. So the complexity, it's very much like this, right?
So what you've basically done is cracked open the complexity and look at it into its parts. You deconstruct the whole thing, and then you help people assemble the package that's just right for them.
So health plans are the same. If you're fully insured, if you're self-insured, if you're level funded, same tools, same box, right? All the components of the box are the same. What you can do is open the box and say, I want this network. I want this TPA. I want this stop loss carrier. I want this pharmacy benefit manager. I want this medical management company, and bundle all of that up into a package that works for your corporate culture and your budget. And I think that working for your corporate culture and for your employees is more important than budget, because when all of the things are working for a good user experience outside of a big insurance company, then employees are happy. I mean, we have plans where if you go to where we ask, and we ask only for high quality providers, then you don't pay anything. People kind of like it.
Wow.
We ask if you use a specialty medication, if you let us source that for you, you don't pay your $50 or $100 or $250 copay. The plan pays 100%. People like it.
Oh, people like that. So can you now just give me the top assumptions that keep people from making the best possible solutions for their corporate culture?
And I have to go to this provider because my doctor said that this provider is the best one. Most of the time, it's not true. My PPO plan gets the best discounts. Almost never true. I'm going to say that's never true. Never true. I have to go to Walgreens to get my medication. Walgreens and CVS are two of the most expensive places to purchase medication. Well, people say, well, it's $30. Your medication is not $30. Your medication might be $80. It might be $300. It might be $800. It might be $4,000. And you're paying $30. You won't see the difference in the cost because you're paying $30.
Wow.
So, there's all kinds of hidden things.
These assumptions that we get really attached to things the way we're used to them. And boy, is that so parallel to what happens in difficult conversations. We don't realize that we're in this lane of thinking because it's what we've experienced. It's how we know how to think about it. And what you're breaking down for us is we have set ways of thinking about how healthcare works and how the costs work. And that actually gets in the way of being able to make more bespoke situations where really we take the variables in the way that we want and create our own situation from them. And I know I sound like I know what I'm talking about when I say that, but I still feel like I only have a clue
but
what it is.
The concept is accurate, right? You can create a bespoke health plan that gives you the benefits that you want, gives you a reasonable cost, helps people access care. A lot of people think that if they're going to cut their benefit costs, that they have to raise their deductible, they have to raise their out-of-pocket, they have to raise their copays. I believe that the opposite is true, that you should encourage people to access as much care as they need when they need it from the highest quality provider. Because yeah, you might pay a few more little claims, but you're gonna pay less big claims.
Okay. What are the things that typically come up in this kind of conversation? Someone calls you and they say, Allison, I heard you're someone I should talk to about healthcare for my business because I have a problem coming up where I have to hire someone, or actually, what are the problems that bring someone to you?
So oftentimes I hear cost, but it is followed by something like this. Look, we spend a lot of money. It keeps increasing. We spend a lot of time trying to do the right thing, and it's not working. So we'll pay this if we have to, but could it at least work for the employees?
Uh-huh. So people who come to you are people who will do what they have to do, but they want to make it work for their employees.
Yes.
So employers who are motivated to have the better healthcare for their employees, and that can actually, as you've said, help be part of corporate culture. It could actually be a benefit of something that makes it great to work with them, is that they've got this healthcare situation. Those are the people who will come to you.
Yes.
And where do they get stuck? Where do you often find you have to guide or lead them through the conversation?
We have, as an industry, trained people that they must, that their health care is their insurance card. Okay. And that is not accurate. That is not accurate.
Well, okay. I just need to take that in for a minute. Healthcare is not your insurance card. So break that down for me, because that's like, right. I have to have an insurance card. If I don't have an insurance card, I don't have healthcare.
Correct. And that is not true.
Okay.
I just had this conversation with a benefits coordinator at one of my clients, and they use some advanced strategies for funding their healthcare, and they do not have a PPO network. And she said, well, I'm trying to find an urgent care center for one of my employees, and she's new, and I can't find anybody. I said, well, he can just go anywhere. She said, well, I just want, she's on her husband's plan. She said, when I need to go to the urgent care, I go to this particular urgent care, I put in my information and I show up. And I said, you can do exactly the same thing, but there's no network. They have, and we've trained to copay, right? And this plan has no copays. It has a $2,000 deductible, 100% coverage. Now, when I look at that, I think that's fantastic. I pay the first $2,000. I don't pay anything else. This is great. Regular, everyday people hate it because they are afraid of what it's going to cost to go to the doctor. We have a mechanism to solve that. And they don't know what their drugs are going to cost. And if their drug costs $80 or $25 or $300, they have to pay that first. And that's hard on people's budgets. So you have to understand how the culture is, and you have to teach people how to use a plan. Now, what we've done for them is any specialty medication, if they call us ahead of time, we can get that delivered at zero cost. Okay. So that solves one problem. We have created a program where they participate in a program where if they need an MRI or they need an outpatient surgery or even an inpatient surgery, procedure, whatever, if they call the TPA ahead of time, the TPA will tell them the high quality, low cost provider. And if they go there, it costs them nothing.
Oh, wow.
We have also arranged with a local primary care physician. He sees everybody. The employer pays for it. The employee pays nothing. So if you want to go see that doctor, you pay nothing.
So there's a $2,000 deductible, but you have a really good way of making it so that nobody ever has to pay it.
Yes, but I don't have a card that says Blue Cross Blue Shield, and therefore I don't have good health care.
That's the biggest. Well, yeah, it's hard. It's a harder thing to trust. Like we've come to trust. And it's really interesting because these are all social constructs. And the same thing happens in conversations, because there are conversations where something feels as concrete to us as a health card, because it's the thing you always say. to somebody. It's the way you ask a question. It's the
Mhm.
what's supposed to happen. And those are the same things that put blinders on that can get us very
Correct.
stuck in certain
And
conversations.
it's a challenge on the side of the provider, right? Because front desk staff it's a high turnover position. The training isn't great. And somebody comes in with an independent TPA and no network, and they just hand it back and say, we don't take this. And then the employee gets freaked out, right? I mean,
Right.
you can understand that, right?
Right.
And so there's some education there, right? I have a client who we couldn't understand. He'd met the family deductible. He was going to see a provider, and the provider was saying, you have to pay us $100 deposit and we're not going to give it back and blah, blah, until the claim is paid at 100%. And we're like, what are you talking about? So the TPA called the provider's office, and the provider's office said, we charge every patient a $100 security deposit. We will return that after the claim is paid at 100%. We will keep it if the claim is not paid at 100%, or if the patient cancels their appointment within 72 hours. Now, I have something very unkind to say about that, but the patient paid the security deposit and was very angry at the health plan. It had nothing to do with the health plan.
Right. It had to do with the doctor, that particular provider. Yeah. So there's things to know about the provider. So they would have done that for whatever the claim
do it for every patient they have.
Yeah. So maybe not the one to go to. Maybe not really where you want to go. But so I'm thinking about is what happens with school forms. I'm like thinking of all the times I have to fill in my provider and my numbers.
Well,
there's
so you have a doctor. I mean, you can have there's many ways to have a doctor. You have a health plan. It's just doesn't say Blue Cross.
Okay. It just there's still a phone number. There's still an ID number.
ID number. All of that is the same. You still have
what's the acronym what's the TPA is what you were saying? What does that stand for?
Third party administrator. So really all Blue Cross is a third party administrator. They administer the claims and they own the network. They are the only insurance company that doesn't rent out their network, by the way. They have reinsurance.
And the difference, but okay.
They have reinsurance. So if I'm on Blue Cross Blue Shield and I have a $300,000 claim, Blue Cross isn't in fact paying all of that. Part of that claim is being paid by a reinsurance company. They have a pharmacy benefit manager. It's called Prime Therapeutics. It is a separate company that is almost wholly owned by Blue Cross Blue Shield. They have a company that does medical management. So all of those pieces together, you can unbundle and choose vendors that have fiduciary responsibility to the employer rather than to Blue Cross Blue Shield.
Wow. I kind of follow, but it is still definitely.
It's very complicated. I'm sorry.
Paradigm shift, and it's very complicated. But what I basically get is that this is really like a tinker toy set. Healthcare is really, and that we tend to only see the constructs or the houses, so to speak, after they've been built.
Not the neighborhood.
We go shopping for a house and we think we need this house or we need that house. And we don't realize that we can actually create our own dream house.
Yes, that is an outstanding analogy, and I will be hijacking that.
Oh, you are very welcome to it. And I also would use the analogy to say that we do the same thing with our thoughts. Like we live in the architecture of our thoughts. We tend to think whatever thoughts you have to yourself a million times a day, create the structure of how you then are seeing the filtering things. And you live inside that structure. And we do that with healthcare. We actually do this with a lot of things, but in healthcare, it's so significant because we trap ourselves in these houses without realizing that we can actually create our own, that we can actually find the exit door and have another, especially if we are employers. We don't have to suffer with high costs and unhappy employees or employees who are off for sick days because it's the only thing they can figure out.
You know, it's a big deal when an employee takes off time to go to the doctor and they need to be able to be seen without a lot of aggravation. And when that happens, often a person who doesn't live in my space will just do whatever the provider says. So Oh, you need an MRI, go down the hall for the MRI. Well, if you go down the hall, the MRI probably costs $3,500 or $5,000. If you say, hold up, let me find a freestanding, let me call my insurance company and find a freestanding imaging facility, that MRI might cost you $400.
Wow.
But
Wow.
to ask somebody to remember that can be a little bit challenging, right? If
Right.
you are changing the paradigm of how somebody thinks about healthcare.
Yeah, well, it's definitely a big paradigm shift. But if I'm a business owner, what are the questions I should be asking myself to
So
get
what
to know
what I
whether
should
this
be
is right for
what I,
me?
what I should be asking myself is this working? Is it working for our employees? Is it working for our budget? Maybe it is, and then you're good. And
What
if
would
it,
qualify working? It's working well if, because I may assume something's working when it actually could be working a whole lot better.
so I look at working on a cost basis, which is not always the way an employer would. I have a client who I was doing a meeting and we were talking about doing this and doing this and doing this. And then I said, well, how much noise do you want? And the CEO looked at me and said, white noise. I want white noise. Okay. Our pace of change is slower.
Mm-hmm.
I have been talking to employers who I'm like, okay. And they're like, we need 20% cut out of this budget in our next plan year, period. Okay, we can do that. Then there are different conversations with employees about how they're accessing a healthcare system.
Okay.
In the United States in 2021, I believe the per employee per cost for healthcare on an annual basis is over $15,000, almost touching 16,000. Employee contribution, employer contribution, claims costs. My most successful clients are running under $4,000. It is a
Wow.
substantial difference.
Wow. Okay. So the question I should be asking is, would I like to try to save money? Would it be worth a conversation with Allison to see if I could save money?
Yes, and
Health?
create a better experience for the people that
Would I
run
like to
my
have a better
operation.
experience? Would I like to save money and have a better experience for my, would they have to switch doctors? Will my
Not
employees have to switch
necessarily, but sometimes, but not necessarily.
Okay. And do you
So,
operate everywhere?
not so much in Hawaii and
Okay.
Washington State and Alaska, but other than that, pretty much everywhere.
And how big a company do I have to make it worth it?
So we can start doing some things for you when you are about 25 lives enrolled. Where our sweet spot is for employers in the 100 to 500 life space. That group of employers is incredibly underserved. They have been trained to think that they cannot manage their risk. They have been trained to think that the solutions that are available to larger employers are not available to them. That is not true. The solutions for large employers are all available to mid-size employers now. And there are other things that we can do for mid-size employers that sometimes are harder to do for bigger employers. So one of those things is integrating a direct primary care relationship into the plan. There are some tools, there are some things that need to happen to do that, but you can take 30% of your spend and turn it from a variable cost into a fixed cost and make sure that somebody can access a doctor 24 hours a day at no charge, or perhaps a very small office fee if they go into the office, because so much healthcare can be delivered via video chat or text messaging or cell phone. I mean, I'm a grown woman. I know when I have a sinus infection. And what do? I text my doctor and I say, annual sinus infection. And it's been my doctor long enough that she knows that, okay, she's got it again. I get a message a few minutes later. Yeah, go pick up your Z-Pack. I lose my voice from time to time. I need a Medrol dose pack. Now she makes me come in for that. But she looks at me, she looks at my throat. She's like, here you go. Yes. We have returned to actual care of patients. It takes an hour to go over my lab work. It makes me crazy. And she's like, you're going to sit here and listen to me. It's healthcare. That is healthcare. There are conversations about clean up your diet. Are you exercising enough? Are you sleeping enough? How is your general anxiety level? Every employer I know is having a low-level anxiety problem in their workplace. A relationship with a primary care physician can address that. Not 5 minutes, right? Not 5 minutes, and then I need to refer you to a cardiologist and an endocrinologist and a dermatologist because I don't have time to deal with those problems. But let me look at you and let me talk to you.
Mm-hmm. So those doctors are still out there somewhere?
And growing every day. Growing every day. Surprisingly, doctors like to be doctors.
Their doctors are looking for ways to free themselves from the insurance constraints.
More and more of them every day.
Doctors, again.
We have a thriving direct primary care community in San Antonio. And employers reach out to those doctors every week to find out how they can integrate their service into their businesses. So there are some tricks to make that work from a financial perspective, because you really can harvest a lot of savings on your health plan, and it's a win-win for everybody. And how many of those are there?
Wow. Well, that's really interesting. And I'm the daughter of a physician who
I know you are.
I listened to him complain as things got more and more bureaucratic and paperwork. And I remember when he said to me, don't go into being a doctor. It's not about medicine anymore.
You know, doctors now have quotas. So many doctors are owned by hospital systems. And if your physician, there's a couple of things to know. This is sort of general information. If your physician is owned by a hospital system, they are only allowed to refer within their hospital system for providers and for services. So you are not necessarily getting the best provider. You may be getting the best provider at that system, but you may not be getting the best provider, and you're certainly not getting the most cost-effective care.
Amazing. So there was a moment earlier you got really excited to talk about being the doctor and getting real care from the doctor. What's that energy for you? What fuels you there?
You know, I talked to early in my practice, you know, it was me and one part-time assistant, right? So we've grown a fair chunk since then, but those early clients of mine, they're not talking to anybody but me. They're just not. It doesn't matter what we do. They call me anyway, and I'm not going to not talk to them, right?
Yeah.
So I see what lack of access to care does to people. And I see what happens when they go to somebody that can spend some time and manage what is going on, right? You know, well, maybe you're a little overweight because you're not sleeping. Maybe it's not what you're eating. Maybe it's sleeping. Let's talk about that a little bit. What's causing you not to sleep? Let's talk about some ways to manage stress. Let's talk about some ways for you to manage your low-level chronic condition.
I mean, there's someone who'll show up for the person instead of just making them feel like it's their fault and they have to just go home and fix things. Mm-hmm. And that really excites you.
It does, because, you know, these are people, right? Like, they're everyday people. And I just think of something my grandmother told me, and this may sound silly, but my grandmother was born in 1919 in Vienna, Austria. Mm-hmm. And my mother was born in 1941 in Vienna, Austria. Okay, so that's kind of a traumatic time in the world.
Oh my goodness. Wow, yeah.
And my grandmother was talking about, we were talking about Adolf Hitler. And she said, you know, he was a terrible man and he did terrible things, but he came to power because he did good things for the people. And then she looked at me and she gave me some look that I've rarely encountered. And she said, war hurts poor people. And I think that is true in so many areas. You know, poor people pay a poverty tax. There's no good grocery store. They rent tires because they can't afford to buy a new tire. They eat only carbohydrates because they can't afford vegetables, or they can't get to where they can buy vegetables. They don't have access to healthcare, so small problems become big problems. Well, you know what? If you make $20 or $25 or $30 an hour now, and that's a huge manufacturing component, you don't have a lot of excess money, and you can't pay $200 to go to the doctor.
Right. And
so
you
how do you
have
fix
access
that?
to healthcare?
Right.
So you're passionate about actually taking care of people.
Correct.
And you got motivated to do this out on your own and have those difficult conversations with yourself because what you were doing didn't align with your own values as much as being able to provide the best care, people care at the lowest cost aligns with your values.
Now, I say that and I'm very passionate about that. I also think that people need to be responsible for themselves. And they need, if I'm teaching you how to engage in the healthcare system, you are welcome to call anybody on my team or me with questions and for help, but you have to do as we ask. And if you don't, sometimes I can't fix it. And that's just the reality.
Because there is some initiative required to ask.
Correct.
What do you think that's in the way of people doing that?
You know, so we've had a rash of trouble lately with providers asking for full payments, even though somebody's met their deductible. And sometimes you can't get that back. So you need to be responsible to know that you've met your deductible or part of your deductible. And you don't owe that. You should never, ever pay a bill without
mental space that I have to track. So this is more of a partnership.
Correct. It is absolutely a partnership. It is a different type of it. This is not a sell it and come back next year, sell it and come back next year. It's not, but it's pretty worthwhile.
But it's worthwhile. You just have to actually be tracking. And so there are probably apps for that or ways that you can.
There's plenty of tools for that. We provide plenty of tools.
Or call and say, my doctor just asked me to do this. Have I met my deductible? And you would know, your office knows. So it can be
So we would direct them to the TPA. We would pull it up, but they can call the TPA first. That's often a quicker way. But yes, we can certainly help with that.
But there's an intervention they can make that's simple, even if they haven't been tracking. So there's the work to track. But if you haven't been tracking, make the call. But if you don't make the call and you're not doing the tracking, so you're not taking, but actually that sounds like life, right? Like you really care about people, want to have access to things for people, but it doesn't just get given to you. There's a step forward you have to take to make things happen in life in order for them to come to you.
In all areas, just like in every other area of life.
Right. Yeah. In every conversation. The reason I asked about that and is interesting to me is because there are places where people hesitate to speak up for themselves because they are so used to a system just telling them what to do. And they are so used to being powerless within a system that they don't recognize their own agency. So therefore they don't step into the agency when it's required.
Correct. And a doctor standing in front of you saying you need to do this, or a billing person saying we're not going to do a procedure until you pay us this, even if you don't owe it, you're going to pay it. Unless you take agency and say, I don't think so.
So that sounds like the big message here. The big message is that you have more agency in your own healthcare. Question it. You have more agency in the healthcare you provide to your team and to your employees because it's a system. And like any system, there are ways to work the system, ways to work outside the system, ways to recreate things within the system. And there's a lot more agency. So as much as we hear that this is what it costs and you get that bill and it looks real and you think, well, that's the same.
It is not.
It can vary as much as bids for your house when you hire a contractor. It can vary as much, and it can be that the best one is going to do it for the least price because they've got the system and they know how to get in and out. They know how to get their pieces. They know how to get their prices, and they're going to be. I also think that sometimes that's because they have stronger leadership. Like there's leadership pieces that often influence delivery pieces.
We use a care management company that steers to high quality care, and we had a client who was not a huge employer. Maybe not quite 200 people. And the member called the medical management company and said, well, I need to have this surgery, blah, blah, blah. And they pulled up the quality score on the provider and on the facility. And the quality score of the provider was under 10 out of 100. And that really pisses people off, just so you know. And but this gentleman was determined that he was going to see this provider, and the staff said, you're welcome to see this provider. Your deductible and your coinsurance amount applies. If you want to go see this provider, if you want this provider to do the surgery as a quality score of 97, same facility, then the plan will pay 100%. He made such a stink everywhere. He cornered the CEO in the parking lot one morning and said, you're not covering this and blah, 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 blah. And we alert when these things happen, because they do happen from time to time. And the CEO looked at him and said, that is not true. We have told you that we will pay 100% if you go to the high quality provider you were recommended to. If you want to go to your provider, you are welcome to do so, but you are going to pay your deductible and your coinsurance. It is in our interest that you are well treated, and you will be better treated over here than you will here, but it is your choice. That is some cojones from a CEO. It is something to have somebody yell at you in a parking lot. And this gentleman yelled at him in the parking lot. I'm pretty sure there were some other issues there, but yelled at him in a parking lot about this. But this gentleman, the CEO, was like, no, that what you're saying is not accurate. This is an accurate assessment of what the situation is. That is leadership.
That is leadership, and that is handling difficult conversations. And much of what I help my clients be able to step into is staying and maintaining that center when there's a storm around you, and also having clarity. I mean, that's what it sounds like there is. He really had the clarity to trust himself and not feel blown over by that wind, and not feel like, oh, he's questioning me. And so it's not a surprise that strong leadership would align with the more efficient, better care providers being able to do that, because that's what makes them good, is that they care and they're able to make it work in alignment within their organization. There's some stronger organizational things happening if they're stronger. Relationship. So then that's all going to match up. And all of it comes back to agency.
Yes.
It really sounds like that also is the like through line for you in moving from where you were working and cannibalizing your business there to create your own business was a step in towards agency and aligning your actions with your values and who you wanted to be and what you're providing. So now what's it like having done this for a while, and has it been worth it?
Yes. So I come from a family of entrepreneurs, grandfather, uncles, father, cousins. And, you know, I think we're mostly ungovernable. We have to work for ourselves. But I like it. I can.
That's what it is, right? We're ungovernable.
We're ungovernable. So, but I like to affect change. I'm a pretty big change agent and a problem solver. And this is a big problem, and it's not going to get solved by the government. It is going to get solved one employer at a time. Now, the government just handed out some really good tools that people are very upset about, but the tools are good, and you can take the tools, deal with the compliance, and get what you want, which is lower cost and happier employees.
Yeah, it really changes the conversation, because so much of that conversation is how much the government provide, because healthcare should be something that everyone has access to. But we all know that when a government provides something, you get this kind of like even, I mean, everyone have access. It might make it easier for the people who don't have access right now, but it creates something that's become bureaucratic and government run. And we fear that. So you're saying there's this whole other solution that can be employed. You're driven. So employers are motivated to have better solutions.
Yes. So government solutions tend to be sledgehammers, and this is fixed with a scalpel. And
ooh, I like that analogy.
And, you know, so they're with a scalpel, because it's every employer is a little bit different. So there's kind of a recipe, right? But every employer needs some little different things to get where they want to go. So you need to be able to make adjustments. But the government did give a big assist with the Consolidated Appropriations Act, which requires employers, fully insured, self-insured, doesn't matter, that you now have fiduciary responsibility for your plan. You need to know what your advisors are being paid. You need to get the gag clauses out of your network, which no employer can do on their own. You need to do drug reporting so the government can track what's happening with high cost drugs, not just with Medicare, but across the commercial market, which insures 50% of the population. And when you see that, then you can take steps to get what you want. You can shift to value care, high value care. You can shift to transparent pharmacy benefit manager. None of those things you want, but you want the result. You want lower cost. You want better access to care. You want a recruiting retention tool for your employees. You want to engage your employees. So this CAA Act will give you the tools to do it.
Well, okay, so I'm gonna have to listen to this several times just to like I really understand the healthcare system because it's kind of like healthcare 101 and yet advanced at the same time. It's a lot, but I think I hope that employers and people who've stayed with us, this is longer than I usually ever go, have really benefited. Well, I think there's just so much there, and I really want. Oh, I've been missing the comments. There are some in here. Wait, hang on. Okay, it's Andrea and Shankar, just encouraging, but not any questions that I missed. Thank you, Andrea and Shankar, for coming and being here.
Yes, thank you.
Yeah. And for being also mavericks in the healthcare world to create better healthcare systems and solutions for employers and employees. And I'm just glad to know that there is more of it out there, and there are people doing this work. So
Andrea and Shankar have created quite the community with Dr. Roger Moxagemba. They've really developed a free market community in San Antonio, and not just providers are attracted to that, but employers regularly attend those events as well. So there's a lot of employer interest in improving the provider-patient relationship and lowering the cost.
That's really great. And San Antonio, site of the Alamo, it's a real place for rebels. I just put that in there. I lived in Texas for a few years. I know the motto was, well, I wasn't born in Texas, but I got here as fast
as I could. Right. Yep. And you know that the Texas Capitol is that the national capital can fit inside the Texas Capitol.
The national capital can fit inside. I mean, DC could fit inside Austin. Oh, no, never really thought about that. I was living just enough. I was living in Austin, but I was teaching in Round Rock, Texas. And it was a little bit of a different world.
It's grown up a lot since then.
Yeah. And I look forward to visiting sometime. Phil, thank you very much. I will bring it to a close now. Because we broadcast to LinkedIn, people on LinkedIn will know easily how to find you. But I will be sharing this elsewhere at some point too. So just give us your info. It'll be in the show notes, but so anyone can find you.
So you can find me on LinkedIn. Our firm is Altique, ALTIQE.com. And so www.altique.com. And my email is acdepauli@altique.com. You're welcome to reach out to me. I'm happy to answer questions. If I can help, great. If I can point you in another direction, terrific. And if not, that's okay too. But have the conversations.
Yeah, have the conversation. Well, thank you so much. It's going to take us off the air. And I hope people will put their questions in the comments so we can come back to in the replay and answer any questions, because I can't imagine not having questions about this. People need to be listening and they need to have questions.
Thank you, Leah.
That's the agency. That's the agency part.
That's the agency.
All right, there we go. All right, we're off. Thank you very much.